Hey everyone, welcome back to our channel. Today, we're diving into a critical topic that affects many expectant mothers, HELLP syndrome. This serious condition can arise during pregnancy and can have significant implications for both the mother and the baby. Before getting into the topic, kindly like and subscribe our channel. So, what exactly is HELLP syndrome? The acronym stands for Hemolysis, elevated liver enzymes, and low platelet count. What do you think about HELLP syndrome? HELLP syndrome is a rare pregnancy complication that mainly affects your blood and liver. It usually occurs during the third trimester of pregnancy, between 28 to 40 weeks, but can occur any time in the second half of pregnancy, from 20 weeks onwards. HELLP syndrome can also develop in the 7 days after childbirth. What are the causes of HELLP syndrome? Still, it's idiopathic, unknown reason. But we have some risk factors which lead to HELLP syndrome, which are age greater than 35, obesity, history of preeclampsia, history of diabetes or renal disease, history of multiple births, history of high blood pressure, antiphospholipid syndrome. We know about causes, risk factors. Next, we are going to see about symptoms of HELLP syndrome. Abdominal pain, usually in the right upper side, specific to HELLP syndrome, headache, blurred vision, nausea and vomiting, fatigue, edema, swelling, and quick weight gain, pain when taking deep breaths. In rare cases, experience uncontrolled nosebleeds, seizures, or uncontrollable body shakes. There are 3 classifications in HELLP syndrome. HELLP syndrome, based on the severity of blood tests' platelet results. Class I, HELLP syndrome, is characterized by a platelet count below 50,000 per microliter. Class II, HELLP syndrome, is characterized by a platelet count of 50,000 to 100,000 per microliter. Class III, HELLP syndrome, is characterized by a platelet count of 100,000 to 150,000 per microliter. How is HELLP syndrome diagnosed? Physical examination for symptoms, following blood tests like complete blood count, CBC, liver function test, kidney function test, and last one, ultrasound or CT scan, computed tomography scan, to check for an enlarged liver or bleeding in your liver. We saw about causes, risk factors, symptoms. Now it's time to see about how to manage the syndrome. Firstly, starts with the medication to lower your blood pressure. Because of low platelet range, we need to start with blood transfusion to treat low platelet levels. Most important is HELLP syndrome patient, more prone to get seizure to prevent that magnesium sulfate infusion is needed. Corticosteroids, which is more helpful to help the lungs of the fetus develop. Often, we need to check the blood tests to monitor your liver function and platelet count. Monitor the fetus with tests like a biophysical profile, non-stress test, and ultrasound. Best management in HELLP syndrome is delivery is the only solution to treat the condition completely. This may mean the fetus is born prematurely. After your baby is born, HELLP syndrome usually goes away within a few days. Always preventive is better than cure. There are some preventive measures. Let's talk about that. Eating a nutrient-dense diet of whole grains, lean protein, fruits and vegetables. Getting regular physical activity. Attending your prenatal care visits. Sleeping at least 8 hours per night. At last we'll discuss about the complications. Complications for the birthing person could include disseminated intravascular coagulation, also called DIC. This could lead to postpartum hemorrhage, severe bleeding after childbirth, kidney failure, liver hemorrhage, bleeding, or liver failure, pulmonary edema, which can lead to breathing problems, eclampsia, placental abruption. Complications for the fetus include preterm birth, intrauterine growth restriction, IUGR, born with low platelet count, anemia, or other blood disorders. Respiratory distress. Is preeclampsia the same as HELLP? HELLP is usually considered a severe form of preeclampsia, but some experts consider it a different disease. Preeclampsia leads to high blood pressure, hypertension, and proteinuria, high levels of protein in your pee. HELLP syndrome typically occurs with preeclampsia, but you can also have preeclampsia without HELLP. About 1 in 5 cases of HELLP syndrome occur without elevated blood pressure or protein in your urine. Thanks for watching. We'll see you in the next interesting topic. Don't forget to like and subscribe.